So, hello, my name is Gill Phillips, the creator of Whose Shoes, and I'm really sorry I can't be here with you in person today, but I hope this gives you a flavour of the Whose Shoes approach and specifically the work that we're doing with Midlands Partnership Foundation Trust. As always, it's all about relationships. Sometimes you just meet the right people. I love to meet people who are passionate about improving their services and who want to do this in a more creative way, engaging with people and pulling them in. I met Lyse through a Liberating Structures session, which kind of tells a story in that Liberating Structures is all about engaging people in more creative ways. So when Lyse asked me to come along and do some Whose Shoes work with her trust, it was an exciting coming together of something a bit different. I'll tell you a bit more about Whose Shoes, but it's now 15 years since I jumped ship from my day job to create the board game, and it's been used across many different topics. Some of our better known work has been around maternity care and also dementia care, but it's always about looking at things from different perspectives and seeking to understand what's important to people. Our main previous work in the children and families space was with CYP Me First. We co-produced a popular card set around communications between healthcare professionals, children and young people and their parents, and this is still available if people are interested. It was clear from talking to Lyse that to tackle the specific challenges MPFT are facing, we needed to do something more bespoke around holistic care for children and families and around partnership working. Whose Shoes is all about genuine co-production, so I was delighted to bring Yvonne Newbold onto our team. Yvonne constantly keeps us in touch with young people and their families to make sure that what we're doing is authentic and likely to be really helpful to them. So having run a bit of a pilot session with MPFT last year, using existing Whose Shoes material, focusing on early years, it was brilliant to start developing some crowdsourced new material together. It's a long-term project and we have a rough map as to the kind of topics we might cover over a series of workshops, but we're looking to see where the energy goes. We want to draw people in and have them demanding to be part of things. Lyse and Yvonne can tell you more about the process, but fast forward to our event in May.
Very hard time. She's so low and long at the time. Oh no, why are you crying? You're going to
Sorry. They're coming today. I know that she's worried. With me,
You don't look at your own story, and then you probably told it me, and then I go to Zoe and go, oh, Mrs. Newbold, you know, her son has got that complicated health condition.
Forms to be a little bit easier for staff to use, they can be quite complex. Some of the challenges that are there, now there are plenty of challenges and we know some of the big ones.
I'm not sure that what happened was the man is something so I'm like, this.
so we need to find out whether there are any yellow light bulbs in the room.
They basically have a one page of what all their BD services do. So I think that's going to help in writing the one page section. Would you like light pink or tiny purple? This is tiny
What we have is new people with their complex needs, where we balance and improve those things.
my pledge was to speak up more when after something to say. Okay, thank you. So this is an amazing outcome that comes from today. I've only brought one of these, so I've actually run out. I've got already more. So this is my JSDI badge, which means just do it. Alias, get today.
So, hopefully that gives you a feel of what we're up to. The material we've produced is quite generic in terms of the issues that people need to think about in terms of making care for children and families more holistic. Each Who's Shoes event is different, but it's always around creating the conditions for people to feel relaxed and valued and to have a bit of fun. We don't always throw a beach ball around the room, but we do try to do something memorable so that people take away key messages. Yvonne Newbold led on a poem focusing on a child with complex needs and inviting people to see things from different perspectives. For example, a verse from the parents, the GP, the pharmacist, the next door neighbour, the sibling. It helped people realise that if you look at your side of the beach ball and see one colour, you're not seeing the whole picture. Who's Shoes creates the conditions whereby people feel comfortable to take part in open and honest conversations, knowing that others are really keen to listen. The scenarios themselves can often get straight to the elephant in the room. For example, services being overwhelmed or staff burnout. And then it's a case of everyone working together to find realistic solutions, or at least things that help move in the right direction. The lemon light bulb moments and pledges are really important parts of our event. You can never tell what will happen, as it will all be about individual people in the room and the connections sparking. But I promise you, if you create the right conditions, there will always be a bit of magic. A key outcome from this session was a new partnership with Staffordshire County Council, specifically the team responsible for children in care. Amy has joined our project team and is busy populating the Padlet, where we're crowdsourcing some new material for a future event around this topic. We're very much seeing where the energy goes in terms of the next areas to tackle, but this topic and also children's mental health are the two front runners at the moment. And of course, working with Yvonne Newbold, we will do bespoke work around children with special needs. It's very exciting, and I just hope we can make a difference in all these important areas. We're aiming to produce case studies of the most significant actions that come from this work. I don't know if we'll be able to match the new neonatal surgical unit which is being built at Alderhay Children's Hospital as a result of our co-production work, but we'll do our best. It's all about building networks and saving people having to start from a blank page. Fab NHS staff are brilliant in helping share our work, and we have our own Fab collection page there. I'm sure Lyse and her team will be keen to welcome colleagues from other services, so keep in touch with what we're doing and come along and join one of our workshops. Also, we're currently up to episode 6 of Who's News, a newsletter that Lyse has set up to keep everyone informed of our progress and to attract and bring in new champions. I love the fact that Lyse is using Sway, an engaging reporting tool, to drop in snippets of information, photos and videos, and I love that this mirrors the creative nature of the project itself. If anyone's interested in using the Who Shoes approach, just get in touch. You can find me most easily on Twitter @Who Shoes or on LinkedIn. Thank you.
That was insightful. I had no idea the full breadth of all of that. So we've got Lyse and Yvonne now, just to perhaps answer some questions that some of you may have. And I think, am I right in saying you may have some material of your own now to move to? Is that right, Lyse, or have I got that totally wrong?
Yes, I do, Joe. I just really wanted to give people a feel for what Who Shoes is like. Since Gill can't be here. I've been close friends with Gill for nearly 10 years now, but this year's the first time I've been invited to work with her on a Who Shoes project. And I thought I knew all about Who Shoes from our many long late night chats, but actually playing the game itself has been a fantastic experience, and it's taught me so much. There's something so leveling about a board game. Everyone's equal, hierarchies evaporate, and really deep, honest conversations, sometimes moving conversations, can actually happen. There's no agenda, so people can really share in a way that share how they feel in a way that can never happen in a clinical work-based environment. I mean, in our family, at one stage, Toby was under 14 different consultants. Some of them I knew really well and I had very good relationships with. But our relationships were entirely based around Toby and his health issues, setbacks, developments, medication, procedures, and sometimes those conversations included some very difficult, emotional, and very raw news. We never got a chance for me to suggest ways that the waiting room experience can be made easier, or anything I'd noticed that might seem a bit bonkers. We were frequent flyers. We were in outpatients once or twice a week, but nobody ever asked us what that felt like. But sitting around a Who Shoes table playing a board game offers a different type of conversation altogether. And the scenarios that we discuss are so incredibly cleverly crafted by Gill, and they really managed to pull out all the important stuff. And yet there's still absolutely no agenda around that table. Who Shoes really can make things happen. And I wish all those years ago I'd have been invited to something like Who Shoes when Toby's health appointments and inpatient stays dominated the landscape of our family. It's such an important resource in hearing from all perspectives equally, and to ensure that co-production is done in a meaningful way to ensure that service design is as good as it can possibly be for everyone. Lyse, anything you have there?
I'm really happy to take questions from everyone. I guess just a little bit about our context. So the care group was formed in 2019 following a merger of two different organisations, one that had dealt with predominantly children's physical health and the other one mental health, but actually also community paediatrics and some children's community nursing. So we're really seeking to bring together and integrate care around children and families. We were looking for ways that we could do more engagement, really, of children, of parents, and ways that we could bring professionals into that in ways that felt productive and positive for everybody. I think it can be really difficult for families to come into an event with professionals and know what's expected of them. And equally, for professionals, sometimes those messages that are shared are quite difficult to hear. And we'd had some experiences prior to my time in the care group where that had been really difficult for staff. The way it had been done hadn't been very supportive. So when I came across, I've been following Gill for a while on Who Shoes, and as she said, we met on a Liberating Structures event, and it was an opportunity to ask more about the board game, and we got talking. I could really see how it might be a useful tool. So you've heard from Gill where we've started and where we're going with it. So it still feels sort of early days, but it has started to create its own momentum and its own buzz, and people coming to say, actually, we want more of this. One of our nurses had a recent conference with other nurses in the care group, and we got the board game out as part of that, just for other people to experience it and demystify it. And again, Yvonne came to that as well as a speaker. And I think people are now seeing the possibilities for using it either small scale or necessarily in big workshops. So we're using it across our range of services and really having it as a co-production tool in our box. So I'm really happy to answer any questions anyone's got, but that's our journey so far working with Who Shoes.
Okay, anybody like to ask this stellar team that we have assembled any questions? Just if you've never heard of Who Shoes, could you just, I'm just really interested, if you put your virtual hand up, we can count who's never heard of it. So I'm assuming from that, oh, hang on, look, 2, 3. Okay, so, several. All right, so there's still work to be done here. That's great. Thank you very much. You've kind of you've made the point for me, really. So this is still in need of publicity and understanding, and we're delighted to help with that.
And I think, John, it's been really active around maternity services and perinatal mental health, and that's where we started with the perinatal mental health. There is one set of cards, as Yvonne said, that CYP me first, but when I looked at those, a lot of them talked about when I was having my cancer treatment, or were quite acute focused, and we're a community provider, hence the work we're doing to co-produce and produce. I describe it a bit like Trivial Pursuits. You know, you can have like the Harry Potter edition or the 80s edition. So we're trying to just create some more scenarios that will chime with the services we deliver, so that we can then use them to have conversations with people about how we could make things better, really.
Lovely, thank you. Well, I think we've got some hands still up. I don't know whether they are still hands up from the little exercise I just did, or whether Jonathan, Simona, or Gloria might like to ask a quick question. If it's the former, Jonathan, would you like to go first? Oh, Simona's got a hand up. Simona, would you like to ask a question? I think it's a legacy. It's a legacy hand from that little exercise I did. Okay, well, look, to be quite honest, first of all, I found that really interesting. I didn't know a huge amount about the Who Shoes project, for want of a better word, but I certainly know a lot more now, and I'll be looking into it in more depth, particularly through the one and only Academy of Fabulous Stuff website.